Well, nice to have you here. One of the things about higher education is the thinking that as we go higher, we require more and more resources. And the thinking is that financial resources would normally do whatever it's supposed to do. But generally now there is a more recent thinking now that there's something like social capital, where people can come together and create value which could not be seen individually. So the social capital and intellectual capital is now becoming more and more important. Intellectual capital to do things together, not as just individual merit, but collectively. So in this respect, if we look at higher education as a governance issue, it looks like the traditional methods of financing and regulation and control seem to be out of place, out of sync with what's happening. So in the opening, we will have a few more questions, but if you could just tell us, Dr. Habib, what you think would be appropriate in this context, especially with your experience with medical field and MCI. MCI is always in the news for the right and the wrong reasons. What would be your view? Is it really able to handle the kind of complexity that we find today in the medical field in the country?
One point you have stressed is the financial resource and constraints a part of higher education. Basically, if you look to education as such, it can be divided into 2-3 segments. First, the basic education, the primary and high school.
That's right.
Then the college levels, then universities where you go for advanced studies and then go for research.
That's right.
So these kind of fragmentation or segmentation goes according to ages.
Correct.
So high school and college is compulsory.
Right.
If suppose you go to college level, then you go to higher education, to postgraduates and then research. There your research is very much valid.
Correct.
Because at that time we require financial resources, human resources, applied focus, knowledge. All the things come together, and your financial constraint or resource constraint is very much seen in that. So that's why we find this higher education is well developed in developed countries, whereas in the undeveloped or being developed countries we don't find that much quality in the higher education. And even in the higher education also, ultimately what contributes is it is the research which we can bring more results to the applied aspects of knowledge. As the famous author management, Peter Drucker says, we have changed or we are landed from industrial century to the knowledge century.
Correct.
So the knowledge is the new resource shifting from the finance.
Exactly.
So how it is going to an economic system we are yet to know, because we don't know the knowledge economy as such. But it's going to be the new resource. That you could see also the savings of the various knowledge workers, where they called higher educated qualified people. They are working in various parts of the world. They are saving their surplus as part of the economy now.
In management, you talked about management. We talk about lean management. Now, is that something, for instance, we could think about in the medical education? Are we really overemphasizing the financial, while the human capital, which seems to be more valued elsewhere, maybe because we have too much of it? Would it be a right to say we need to marshal this energy in a directed fashion, so that we can get the better value for whatever we spend?
That is true. See, higher education, whenever you go into a professional education, when you go into the scientific field, engineering, medical, nursing, all other areas, that requires a lot of equipments and other resources. It's very expensive. Whereas we go to higher education in the arts level, MA or humanities and all the things, it doesn't require that much resources. So one of the major problems we are facing here is in India particularly, the quality of higher education has not come to the level of Western countries. That is because mainly lack of resources. And most of the higher education system we are following like colleges or high schools level. not so in the Western countries. Highly advanced higher education in the highly resourceful. Government is supporting one side, then public is supporting another side, then social responsibility by the corporate is also there. Pulled together, they put the finance.
That's right.
So surplus creation is not a possible in higher education, which unfortunately is being mistook in India.
Okay. I would like to address this issue to Dr. Devraj.
Yes, sir.
In case we say, okay, resources are required, especially in the professional area like medicine and engineering.
Yeah.
Now, other fields, I mean, probably as Dr. Habib was saying, resources really what we have between our 2 years. So why is it that we have not, for instance, developed in the social science areas, for instance, where we could probably, create a lot of understanding, especially with the traditional knowledge that we claim that we have, which is true at one level. Are we really marshalling this, in the manner in which we really should be doing?
Slowly, we are coming up to the level what you expect, but it takes a time. India, as you know, it's a big country, and we have a huge population, and majority of the people are not highly educated.
Yeah.
Step by step, we are in the process, and I agree that we may not require that much of infrastructure what is required normally in medical and engineering colleges, but still we require some social infrastructure and support from industry and social organization. And it is not only the government that can help us in all this respect, even the private people and social entrepreneurs should enter into this education field, and we must help our youth to come up to the standard what doctor is telling. The same way quality education is to be imparted, and for that we need qualified and competent people. And in India we have so many universities, almost 800 universities, so many autonomous institutions, and all these things will be helping us to develop the people. But as it is, we are finding it is not up to the level when compared to international standard, but slowly we are emerging, and it takes time. And we should encourage people, more and more people, to enroll to higher education also. And the total percentage, if you take at the international level, our percentage is not up to the mark. I agree that because of the huge population, when you take that, definitely our percentage.
We need to take a break here, sir.
Yes.
We'll come back and we'll
Yes.
carry on the discussion. Dr. Habib, talking about this private and public participation, what is your sense about this in the medical field? If you compare the public sector versus the private sector, both in the professional as well as in education. Also, is there a third sector emerging where this kind of cooperation is happening, or if it's not happening, is there some way to promote it, like the cooperative movement? That's neither complete capitalism or runaway capitalism, nor complete government bureaucracy. Is there something in between that is possible in the medical education now?
The medical educational field, if you look into that, a lot of problems are there. Now the new MCA is being replaced, some new act and all.
Right.
The government is trying to prepare. A lot of discussion going on, and quality and standardization, etc. is being discussed. Now the thing is, higher education medical field in our past experiences can be done mostly by the government.
Correct.
For example, now All India Institute of Medical Science was started with the government.
Right.
The whole idea was to promote higher education,
Correct.
postgraduates mostly
Right.
there.
Right.
Then you got Nimans there in Bangalore.
Right.
Tata Institute is a private now.
Yeah.
Started, but now government plus I think a lot of aids are there.
Yes. Yes.
So all this higher level of education which cost a lot of resources, finance
Right.
as well as other
Yes.
resources,
Yes.
required combined participation of government plus public together, private-public participation. Medical field especially should go more on research.
Correct.
Now the MC is very keen on research on medical education,
Yes.
which was
Yes.
not there earlier.
Okay.
to 3 decades back, there was no such thing as the research. Now very much on research.
Okay.
So continuous research alone will bring our education higher level.
Correct.
Another thing which, when you talk education as such is a new resource.
Yeah.
What it could bring as a part of economy, according to Peter Drucker, what he said.
Yeah.
We have our own experience. For example, now if you look to our Indian population, which is quite big, and to advantage we had with the British rule, all colonized, and what are the problems we had earlier, but we had some advantage. What they contributed to India, one is English language, another is the railway network where you could integrate together. Because of the English language, we are able to assimilate ourselves to the modern development, which is all in English.
Yeah.
And if you see the early government which gave a lot of importance for education, and because we got such a large population in India, and educated people found a better survival existing outside India.
Yeah.
And many of the educated people are in the Western countries.
Yeah.
You take UNO, WHO, or a private organizations.
Sure.
Corporate level,
Head of Google,
and
head
all
of
Indians.
Microsoft,
Thanks to the education system what he started
So
here.
something is right with our education system.
Yeah,
too.
education system started here.
Yeah.
So it should be further developed into a quality,
Yeah.
which they get once they go there.
Yeah. Yeah.
Once we all slowly, as you said, we are coming to that level. I am sure in coming decades, India will be a dominating country because of our knowledge, education, and English put together.
Talking about Dr. Devaraj, talking about this, the idea that when people go from here, they seem to work in a different environment and succeed. So ultimately, there's nothing wrong with the raw material as such, but there seems to be something not quite right about the ecology that we are creating for our youngsters. What you're saying is very interesting, because one of the things that observers have noticed is that in the IT sector, I mean, we have done reasonably well, world over. So they say there were no controls initially, because there was no way to control the university, because universities were not offering these courses. So there were the private sector institutions came up with this enormous franchising system, which grew at like 50-80% annual growth rate. So that growth was there during the initial phase. So perhaps it would be right to hypothesize that India could manage this kind of huge potential, releasing this potential, because there were no excessive controls put on the sector. So perhaps with MCI, what will be the? I mean, I'm coming back to Dr. Habib, Medical Council. What is it because they didn't have the freedoms, or they did not use the freedoms in a proper manner? Because when we read newspapers, we get the impression that yes, MCI was an independent body with its own autonomy, but that autonomy, perhaps at least from all the newspaper reports that we get, it was probably they didn't have it in them to self-regulate in a responsible manner. What's your view on that, sir?
See, one of the things what we have, as I said earlier, on advantage we had from the British colonization, etc. We learned English language, but the disadvantage we had is we followed many of the system which has become obstinate. The civil system itself, at that time they wanted for their benefit, our graduation course, etc., etc. We have failed to make a tailor-made educational system for our Indian population.
Okay.
If you take the medical field as such, we are following a typical of Western system of MBBS and then post-graduation, etc., etc.
Right.
And they are asking all these qualified people to go to the villages.
Right.
Which they have never had a chance of village at all in their courses.
During the program.
And none of them wants to go there. So the quacks come up in the villages there. And they want to equate the quacks with the other thing. That's why the MC has got a lot of new thinking process. Ayush and other programs and all. So what we have failed in education from the medical point of view or health point of view is we are not able to design a course required to the Indian population. I always said in the many university programs there, you must start a separate rural program for the villages in healthcare. And rural doc, something like a Vaidya system of tradition which was prevailing earlier days. Need to have some mostly on the health promotion, disease prevention, environmental sanitation,
Yeah.
emergency care, etc., etc. A new course, exclusively in the villages,
Right.
not to mix it with the medical colleges.
Okay.
And that should be done only in the village area with this environment.
Yeah.
If you make a course like that,
Yeah.
perhaps that would meet the needs of our people there.
Yeah.
Now what you are trying to do, postgraduates, qualified specialists and all the things to go to the village, what they can do.
Yeah. Yeah.
So we have to rethink on that level to tailor make education to the needs of the community as far as healthcare is
So
concerned.
there's a mismatch
Yeah,
between.
mismatch.
Yeah.
The thinking process has to go in this.
Yeah.
I think I have talked in several occasions.
Yeah.
Manipal also I talked, with my parent institution, NAPA University also. We had some talk there, here in Mangalore. Let us see who takes up the initiative and have a break there.
Okay.
That can give a new insight to the education as far as healthcare is concerned.
Okay.
Similarly, also in other area we find like, graduation, commerce and all old courses. We may have to, as you said, the new area what is relevant to the situation now.
Situation,
IT industry are going to totally different from graduations.
Okay. Thank you very much.
Over.
Thank you, sir. Thank you.
Thank you. Thank you.